Hi, I'm Austin Akers. I'll be your student nurse today. Can you please state your name and birthday, please?
Eric Morris, September 13th, 1990.
Okay, the patient seems alert and oriented. Earlier obtained vitals on Mr. Morris. All the vitals, height and weight were all within normal range. He is dressed appropriately for the weather. His gait was normal when he walked in, and his posture was erect. I'm going to be doing a full head to toe assessment today. It'll take about 30 minutes, try to get you out of here as quickly as possible. Is that all right?
Yes.
So we're going to start with assessing your head. I'm going to palpate. The head is normocephalic. It's round and symmetrical. I feel no lesions, lumps, or abrasions during tenderness. Okay. Hair is healthy, evenly distributed, brown and cut short. Notice no parasites. Your facial features are symmetric. The ears are equal bilaterally. Can you smile for me? Frown. Close your eyes tight. Puff your cheeks. Okay, cranial nerve 7 was intact. Now I'm going to palpate some sinuses. You may feel pressure. Should be no pain. That's your frontal. Any pain there? No. Maxillary? No? Okay. Going to palpate your lymph nodes. You got preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Was there any pain there?
No, sir.
Okay, good. The skin is warm and dry. It's equal bilaterally. I see no lesions, lumps, or abrasions. His color is smooth and consistent with his genetic background. Skin turgor, good elasticity, which means you're hydrated, so that's a good thing. So now I'm going to assess your eyes. Can you raise your eyebrows for me? Okay, cranial nerve 3 is intact. Earlier I obtained a Snellen test on Mr. Morris. With corrective lenses, he saw 20/20. Say it was 20/30, that means that he could see at 20 feet what a typical person could see at 30 feet. So I'm going to assess the eyes. The lids are no redness, no lesions or abrasions. Could you open your eyes for me? The eyes are symmetrical and round. Pupils are around 4 millimeters, round and symmetrical. Irises are blue, round and symmetrical bilaterally. The cornea is clear, no opacities. Sclera is china white, no tears or lesions. The conjunctiva are pink and moist. See no lesions, swelling. Lacrimal ducts also pink and moist, no lesions, excessive drainage. Now we're going to do a few eye tests. First we're going to start off with corneal light reflex. If you could look past me. Okay, the reflection was in the exact same spot in both eyes, which is what we're looking for. We'll now do a cover test. Just stare at me. Okay. Alright, good. The gaze was steady and fixed. No deviation there. The next test is called a confrontation test. What you're going to do is cover the same eye, or the opposite eye of me, your right eye, if you could hold it, your right eye, and tell me when you see my pen light.
Now.
Okay, can you do the other eye? Okay, good. That is just testing your peripheral vision, which is which is good. Now we're going to do something called test your cardinal fields of gaze. If you could just follow my pen, just with your eyes. Okay, good. Eyes move parallel. That means that cranial nerve 3, 4, and 6 are intact. We're going to do another test. We're going to test your pupil accommodation and reaction to light. So if you could just stare past me, and then when I tell you to, look at my pen. Okay, the pupil's constricted, which is what I was looking for, accommodation. So now we're going to test your pupil dilation, constriction. Look past me and, okay. Alright, good. Both pupils constricted to light. So pupils are equal, round, reactive to light, and accommodation. Now we're going to take a look inside your eye, Mr. Morris, if that's alright with you. Okay, just keep looking forward. Come in at a 15-degree angle, see the red reflex. The optic disc is creamy yellow. Arteries and veins are present and paired. Take a look in the other here. Okay, again, red reflex present, the optic disc creamy yellow, and your retinal arteries were present and paired, which is all good findings. So now we're going to take a look at your ears. They're symmetrical, equal bilaterally. Is there any pain there?
No, sir.
No? Alright. Take a look inside here. The ear canal, there's no redness, lesions, abrasions, or any excess drainage. Take a look inside. Alright, tympanic membrane is pearly gray, no bulging or retraction. Corneal light is at 7 o'clock. Umbus, malleus, manubrium, all present and intact. For video purposes, I'll just be checking the one ear. The other ear, I do the same thing. Corneal light should be at 5 o'clock in the other ear. So I'm going to do some something called a whisper test. If you could cover your right ear and repeat what I say.
ABC.
Left ear.
1, 2, 3.
Okay, good. Cranial nerve 8 is intact. Something called the Weber test. Can you hear this?
I can.
Okay, good. Now the Rennie test. I'm going to activate the tuning fork and place it on your mastoid process, and we're going to measure the difference in time of bone to air conduction. Okay. Air should be twice as long as bone. So, tell me when you can't hear it. Okay.
Can't hear it.
Okay, good. Air conduction was twice as long as bone conduction, which is good. So now we'll take a look at your nose. Nose midline, no lumps, lesions, or abrasions. Take a look inside. You could lean back a little bit. Okay, nares, the mucosa is red, smooth, no excessive drainage. Turbinates, red in color, no polyps noted, and nasal septum shows no deviation. We're going to do a smell test. If you could close your eyes, include one nostril, and tell me what you smell.
Alcohol.
Okay.
Alcohol.
Alright, cranial nerve 1 is intact. Now, we're going to test assess the mouth. The mouth, lips are symmetrical, pink, lips are pink and moist, no cracks or lesions, open your mouth for me? Buccal mucosa is smooth, pink, and moist. The Stenson ducts are present. Anterior posterior pillars are pink and moist, soft and hard palate, pink and moist. Uvula is midline. Could you raise your tongue for me, please? Okay, tongue is midline, frenulum midline, and Wharton ducts are present. Could you say ah? Okay, soft palate and uvula rose at the same time. That means cranial nerve 10 is intact. Check your gag reflexes. Okay, cranial nerve 9 is intact. And we'll do a taste test. Also test cranial nerve 9. If you could close your eyes and tell me what you taste.
Salt.
Okay, cranial nerve 9 is intact. That's good. Could you open your mouth for me again? Okay. No, seems like you have good oral hygiene, no dental caries, wisdom teeth are actually absent. Are your tonsils? Okay, tonsils are present 1+, which is normal. I did need to test one more cranial nerve and also assess for TMJ. If you could open and close your mouth. Do you feel any crepitation, popping, or anything like that? Okay, I didn't feel any. No TMJ. Can you clench your teeth? Alright, good. That's cranial nerve 5. And close your eyes and tell me when you feel something.
No.
Okay, good. Cranial nerve 5 is intact. Alright, now we'll assess the neck. I'm going to assess the trachea. If you could lean back. Okay, trachea is midline. Now I'm going to assess your thyroids. If you could lean forward to the right. Okay, swallow. Alright, to the left and swallow. Is there any pain there?
No, sir.
Okay, thyroid show no tenderness and actually non-palpable, which is normal. So I need to assess your carotid arteries. Okay, present 2+ and present 2+. Need to auscultate those carotids with the bell. Okay, good. No bruits or waves, which is good. Now we're going to move down to your chest. If you could take your shirt off, if you don't mind. Okay, chest is symmetrical and elliptical in shape. AP ratio, lateral ratio 1 to 2, which is good. Hair is evenly distributed for and normal for a man of your age. Skin is even, consistent, smooth, and consistent with genetic background. We're going to listen to some of your heart sounds. Okay. Just breathe normal for me. Posture's relaxed. We're going to listen to your aortic valve on your right sternal border, second intercostal space. Okay. Pulmonic valve is left sternal border, second intercostal space. Okay. Tricuspid valve is left sternal border, fifth intercostal space. And mitral valve, left mid-clavicular line, fifth intercostal space. Okay, that's good. S1 and S2 were noted. There was no murmurs or extra sounds, which is good. That's what I was looking for. The S1 is more notable at the apex of the heart, which is the lower left area, and the S2 is more notable at the base of the heart, which is up at the top. Alright, now we're going to listen to some lung sounds. Just breathe normal. Okay, good. Lung sounds were clear. Now I'm going to actually do the same thing in the back. Need to listen to some lung sounds. If you could, turn to the side for me. Yeah. Just breathe. Take a deep breath. Okay. In. 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 Okay, good. Lung sounds were clear with no adventitious sounds. I'm going to percuss these same areas. Okay, it's resonance throughout. Now we're going to do something called tactile frenesis. Say 99 every time I touch you.
99, 99, 99, 99, 99.
Okay, I felt vibrations throughout. We're going to do something while we're back here called a CVT test. It's just test your kidneys. You may feel a thud, but it should not hurt. Let me know if there's any pain. Any pain?
No, sir.
Okay, good. Now, I'm going to assess the abdomen. If you could lay down for me. Okay, the abdomen is flat with an inverted umbilicus. Skin is evenly colored, consistent with genetic background. Hair is evenly distributed. We're going to start with some palpations of the 4 quadrants. Light palpations to start with. Got right upper. Let me know if there's any pain. Left upper. Left lower. Right lower. Is there any pain there?
No, sir.
Okay, go a little bit deeper. Check for any masses or and organ placement also.
Okay.
So let me know if there's any pain. Any pain there?
No, sir.
Okay, I didn't feel any enlarged organs, so that's good. No masses or anything like that. So we're also going to percuss the same areas.
Okay.
So, any pain or anything? Okay, general tympany throughout. There was I heard dullness over the liver, which is normal.
Okay.
Going to listen to some bowel sounds. Okay, good. I heard active bowel sounds in all 4 quadrants, which is good. Now I'm going to auscultate your arteries.
Okay.
Got aortic. Okay. Renal. And iliac. Okay. Heard no bruits or waves, which is good. Alright, you can hop up now. You can put your shirt on if you'd like. We're going to do some musculoskeletal assessment. first going to test the muscle strength in your upper and lower extremities. If you could hold your arms like this and against my pressure, okay? Alright, legs. Okay. Good. Muscle strength is good, and even in upper and lower extremities. And while I'm thinking of it, I need to assess cranial nerve 11. So if you could shrug your shoulders for me. Okay, good. Cranial nerve 11 is intact. Now, we're going to do some coordination tests. So the first one is rapid alternating movement of your fingers. If you could start touching each finger to the thumb and increase. Okay, good. That's good. Shows good coordination. Now we're going to do some cerebellar tests, some balance tests. So if you could stand up and could you do a heel to toe walk for me? And go back. Okay, good. Shows good balance. And something called the Romberg test. We're going to test balance also, equilibrium. Just close your eyes. Okay, no excessive swaying there, which is good. We're going to do something called the graphesthesia and stereognosis. If you could close your eyes and tell me what you feel. Alright. Now, tell me what I'm drawing.
The number 8.
Alright, good. Now I need to test some deep tendon reflexes. So we will start with your tricep here. Good limp. Alright, good. Now, brachial. Okay, good. And if you could have a seat for me, we'll test the patellar. Okay, good. And Achilles. Limp. Alright, good. All of your reflexes are present 2+. I would assess bilaterally, but for video purposes, we won't do that. Let me test your pulses. Test your brachial. That's present 2+. Radial. Present 2+. Dorsalis pedis. Present 2+, and posterior tibular. Present 2+. Let's test some capillary refill. Okay, less than 2 seconds. That's good. That's normal. Gonna do some range of motion test. If you could stand up for me. We'll assess your neck first. Do some flexion, extension, lateral bend to the left, right. Did you feel any crepitation there? Okay, no, I felt no crepitation either. For the spine, you do flexion, extension. Any pain or crepitation? No? Alright. The right arm, we will do abduction up, adduction down, and circum. Okay, good. There's no crepitation there. Alright. We're going to do the knee as well. And lift up, flexion, and extend down. Okay, good. No pain, no crepitation. Alright, for the ankle, you can probably sit down for this to be better. Alright, you're going to press the gas pedal, plantar flexion, and release. Dorsal flexion, alright, and eversion and inversion. No pain, no crepitation. Okay, good. Let me take a look at my notes, and I believe that concludes everything, but I will check and see. Okay. I'm gonna test a cranial nerve. I forgot. Can you say light tight dynamite?
Light type done.
Okay. Cranial nerve 12 is intact. And I forgot to mention that the Snellen test, the one of your vision, the 2020, that actually lets me know that cranial nerve 2 is intact. So do you have any questions for me?
I don't.
All right. Thank you, Mr. Morris.